Hello, I'm Dr. Russell Libby, and I welcome you to the world of medicine. You know, no other health condition affects as many people or has such significant medical and economic impact as obesity. It's epidemic in our country and worldwide. It seems that people, well, they're eating too much, they're gaining weight, they may in earnest want to lose that weight, but as they keep gaining more, it becomes more and more difficult to lose it. And with that weight exacts a toll. Their health, arthritis, diabetes, heart disease, depression, all kinds of medical issues that are extremely difficult for them to deal with. And when they try to diet, well, a lot of them get to the point where it becomes a futile road, a Sisyphean rock that they keep pushing up and rolls back on them. But about 15 years ago, we came upon a set of procedures that now are known as bariatric surgery. It's a very specialized area that surgeons will perform certain types of operations that will allow people to facilitate their efforts to lose weight. We have with us a very excellent surgeon, a bariatric surgeon, Dr. Greene. He practices at Shady Grove in Rockville. And we have an incredible audience, folks who are here willing to share their stories about what it's been like to gain weight and to try to lose it and to gain it back and to deal with all of the internal machinations and all the medical complications, and then to finally make a life-changing decision that they can undergo bariatric surgery and really find their lives changed. So we're talking about obesity and the epidemic proportions, and I know that there are all kinds of statistics, but none better to tell us about them than you, Dr. Greene.
Well, as you said, obesity is an epidemic in this country. We measure obesity by the body mass index. But it doesn't matter how accurate you think that is or not, there are about 12 million people that are considered morbidly obese. That means they have a BMI greater than 35. Another 20 million people have diabetes and BMIs between 30 and 35. In order to get to a BMI of 30, you really have to be at least 60 pounds overweight. BMI of 35, you have to be at about 70 pounds overweight. So we've got an enormous amount of people in this country that are markedly overweight and suffering from the medical conditions like diabetes, sleep apnea, as you said, the others, which are really killing them.
And when we talk about people, I guess we're talking about adults, and I know as a pediatrician I will see a lot of kids, and we see an incredible population evolving with weight problems starting very young. A lot of that having to do with access to food, of course, and inactivity, because so many of them are screen addicts, having to sit in front of computers or game screens, and they don't get outside and play. They don't get the athletic or other activities that might help them sort of balance that thing. But we think of it practically that almost 2/3 of our population are overweight and sitting there primed and ready to become obese that way. I want to hear when did you first, well, first let's start, were you a big baby?
I was a pretty average baby. Probably when I was about 7 years old, my parents started noticing that I had a weight problem by the age of 7. So I went through a good portion of elementary school, middle school, high school as an overweight person.
Yeah. And your dad?
Yes, she was. We tried to put her on some type of exercise program. Her pediatrician said, don't worry about it, she'll grow out of it. I was concerned because I thought it would have an impact on her heart, her lungs, and would cause her health problems in later years. So we tried to get her on an exercise program, and she did. She played in sports in school a lot, but it didn't have a measurable impact.
So you were a formidable force, I would imagine, on the field.
Yes, I was. I played soccer for 6 years, and they always put me as the goalie. Yeah. Didn't really like that position.
Right. You filled up enough space so that you could decrease their opportunity to make shots. And did they have a nickname for you while you were out there?
Yeah, when I was in middle school, a lot of the kids called me Diesel.
Diesel.
Yeah. I wasn't very fond of that nickname.
But did you have a self-perception that you were overweight? I mean, did you feel when you were very young that you were overweight? Did people tease you when you were a little kid?
Besides the nicknames in middle school, I had a lot of friends. I never really had too many problems. I always knew that I was overweight compared to other people, but I was still healthy and I was comfortable in my skin. It probably wasn't until later on in life when I had a massive weight gain that I realized that my weight was a major issue.
So, at what age? So you were always a sort of a stocky kid. But at what age did you really start to put weight on?
My average adult weight was 225 pounds. Right. And then in 2006, I moved out of my parents' house into my own place, and I gained about 80 plus pounds in 2 years. And I finally weighed in at 308 pounds.
So you really missed that home cooking, I guess.
Yeah.
So that was, how old were you then?
I was, oh my goodness, I was 25 years old.
25, okay. Were you big as a baby?
9 pounds, 6 ounces.
That's a good size, healthy size. Well, not unhealthy yet. But how was your childhood? Were you overweight as a child?
I was always a little overweight, and I didn't really have a massive, I don't know about massive, a big weight gain until after I turned 30. And something happened in my body, and it just the metabolism slowed way down, and the weight started going up. Now, I was able to control it at first for a little while, but then I ended up gaining about 120, 125 pounds in the last, 15, 20 years.
Wow, so you grew another person.
Yeah.
Practically,
yeah.
Wow. And were you big as a baby? Were you?
Well, it was such a long time ago.
Recollections?
I think I was pretty much average size.
Average size, yes.
I was always heavy. Always on the heavy side.
Okay.
Yeah.
So that was through your life. Was there any point where you had a real wicked weight gain?
I think it was after I stopped being as active, when I got into my 25, 30 years old.
So did that have to do with your weight already at that point?
Yeah, I was at high school. When I played high school football, I was like 6 foot 250.
Right.
And,
Coach probably thought you were great.
Yeah, yeah.
Couldn't feed you enough,
That's
right?
That's
yeah,
right.
I'm sure.
And then the activity started to go downhill, and I started gaining weight, and then all of a sudden I bloomed up to close to 500 pounds.
Wow, 500 pounds.
482 to be exact.
482.
That's close enough.
I would say. How about you? Were you a big baby?
No.
No?
I was under 7 pounds.
Under 7 pounds, okay.
My weight gain came from a bad marriage,
A bad marriage.
emotional eating, and then I took the weight off after I got divorced, but then at age 38 I got mono, and for 2 years I was exhausted, and I stopped. I couldn't do the walking. I would just come home from work and just go to bed, and before that point I would walk for 2 miles and I would dance, and I put weight on then.
So Dr. Greene, we're hearing a couple of different stories. Obviously, none of them really are born obese, although we do see big babies. Most obstetricians are pretty conscientious about controlling what happens to those babies. So what stages in life do we see weight gain, and where are the times people should be aware where they might have some opportunity to helpfully intervene?
Well, obesity is a disease of abnormal fat metabolism. Obese patients become markedly overweight, not because they're just eating and not exercising, although on occasion someone has their rapid weight gain coincident to a time when they have an injury, and they're used to eating, say, 2,800 calories, and they're used to expending 2,800 calories, and so their weight's stable. Then, coincident to the time they have that injury, they begin to gain weight because they don't decrease the amount of calories that they're taking in. But the common times in life when people gain weight that we hear over and over again is whenever there's a marked hormonal change in their body, like with puberty, with pregnancy. There's a large change in the hormones of our life between our 38 year and our 50th year in life, either female menopause or male menopause, whichever. But you see a large change in the hormones, and people gain weight dramatically then. Of course, there are there are multifactorial reasons why people would gain weight, but those are the common ones.
So that's when you really do start to see that blossom. And I guess that sort of lends itself to a little discussion on some of the theories behind why some people become obese and others don't. I mean, obviously, we talked just now about how you might get an injury, you don't decrease your caloric intake, and that gradually adds weight on a continuing basis, which is basic, simple mathematics, right?
Right.
But there are some theories out there as to what goes on, and you were just alluding to one with the estrogen or the hormonal issues.
Right. The hormones of our body, typically testosterone, increases the cell metabolism. And as we change in the balance between estrogen and testosterone, whether it's a male or a female, that change sets off cells to bring calories in from the food that we eat into the liver and shift those calories out of the liver more quickly in the obese population. You've probably heard many people say, well, I have a friend who eats and eats and they don't get heavy. How come? It's just not fair. It's because those patients keep those calories in their liver in a storage form, glycogen. It stays there for about 8 hours in a typical person. But in an obese person, the glycogen is moved out of the liver much faster. They get hungry more quickly, and they eat more food because they have the signal. There are multiple hormones in the gut. The most well-known is leptin, which has been about, 6 years ago, identified in a few populations and a few small cohorts of people in the world where they're born to be leptin deficient, and they gain weight dramatically from the time they're a child. We can measure leptin levels in patients and see that their leptin levels go down whenever they're on a diet. And that's the signal to the brain to eat more. So there's a lot of hormonal stuff going on here, and we believe that obesity is really caused by genetics.
So, did you have a family history of people being overweight?
Some of my siblings, I'm the oldest of 8.
Right.
Some of
Okay.
my siblings are, but some of them aren't.
Right.
So it varies.
Well, I guess so. You think half?
Half,
So maybe 50%.
50%.
Okay. Well, I guess that's not a bad statistic. Were you a big baby?
Actually, I was a small baby and sickly baby.
A sickly baby.
I was premature and I had a valve leakage in my heart, and that was repaired when I was 3.
Mm-hmm.
And from that time, my parents just fed me and didn't let me exercise or
Right.
encouraged you to go out and play around and run around because
You were a
sick.
vulnerable child.
Mhm.
And that's not unusual that,
Yeah.
that babies, and were you the first baby?
I was the last baby.
You were the last baby, so you were the most cherished of them all.
Mm-hmm.
You were, but a lot of times you do, you worry about those kids and you don't want them to put themselves in harm's way, especially when you know that you've put so much into trying to make sure they would be okay. So they fed you, and cardiac babies sometimes have a hard time gaining weight.
Well,
Not you.
not me.
No, okay.
And I gained weight and kept gaining and kept gaining.
So, were you always a big eater? Was that how it was, or was it just something that just sort of accumulated over
I think
time?
it accumulated. There's 7 people in my family, 5 kids and 2 adults, so there wasn't huge portions,
Right.
as a kid. But
Were they all overweight in
No.
the family? No? Okay.
No.
Okay.
My father's overweight. My father's side of the family was overweight,
Right.
but the rest weren't. But as you went to college and started going out eating,
Right.
portion sizes got bigger. You
Right.
eat while you're studying.
Beer,
stay awake.
pizza,
I never started
right.
drinking alcohol.
Okay.
That was a good thing for me. But
Right.
you stay awake, you eat. Study, you eat. Things like that.
Yeah.
And so just kept going and going
kept
and going.
How about yourself? Were you big as a baby?
No, very average
Yeah.
as a baby. Probably a little bit larger as a child growing up. Always felt like I kind of wore clothes that were a little bit larger than everybody else, but never felt that I was tremendously overweight. I was very active, played in sports, was a cheerleader in high school, but once the activity slowed down and I went to college and was eating while studying and eating on the run and doing all those kinds of things, that was when the weight first started accruing. And at the same time, I started trying to diet. So I began the yo-yo cycle of try a diet program, lose some weight, gain it back, lose it again doing something different, and it just kept accumulating as I got older into adulthood.
Yeah, I want to go back to that in just a minute, but so we have heredity, as you were saying, is a big one. We've heard that viruses might have something to do with it. I'm not sure if there's been enough research there. It would certainly be amazing if we could come up with a vaccine.
That would be great.
That would be amazing, wouldn't it? That would prevent it, but there are some viral implications. As you say, those hormones that are produced in the gut or in your gastrointestinal tract that may be aberrant either in the amount that you make and your brain's interpretation and the cycles that you go through. But a lot of it seems that it could be just certain stages of life where your lifestyle changes and you're eating calories that you're really not paying much attention to, and what, as you were saying before, your exercise was fine and burning them up until all of a sudden you're sitting in a library and studying and staying busy that way.
Or emotional even can be a problem when people have major life stressors. They can respond to that by eating, especially late at night. So a big part of our programs is working with psychologists and therapists, nutritionists. So education is a large part of the therapy for obesity.
So you were saying you had tried lots of types of diets.
Mm-hmm.
List a few.
List a few?
Yeah.
It'd be easier to list the ones I didn't do.
Okay, I would imagine that's probably true. Yes.
Jenny Craig, Weight Watchers, Slim Fast, Fen multiple times with the different programs, and sometimes the weight would come off and it would stay off for a little while and then I would gain it back. Obesity runs in my family, and so I was fighting that uphill battle as well as trying to just control what I was putting in my own mouth.
And can you give us an estimate as to how much weight you've gained and lost and gained and lost?
Oh, wow. At my highest, I was 311 pounds.
Okay.
This go-round, since meeting Dr. Greene, I've lost 108. Prior to that, I would average anywhere from losing 30 to 60 pounds to then gaining 50 to 80 to 100 pounds. So it would swing back and forth.
So
Having
you'd have
children contributed to it too.
100-pound weight swings in months, over periods of months, possibly.
In theory.
And did you ever look at the quality of the food? Did you think you were eating healthy while you were going through these swings?
I did. I mean, I think there were times when I was on programs. When you're on a program like Jenny Craig, the food is mapped out for you. I didn't have to think about it. And that's probably why I wasn't successful. Because once I would wean myself off of it, then I had to make the choices. And even if my head knew what I was supposed to do, I still wasn't making the right ones. Somebody else had decided before me up to that point, and it was a lot easier.
It was easier. You were still emotionally too attached to your eating.
Mm-hmm.
How about, did you do a bunch of diets?
I started Weight Watchers when I was 28, and I would lose 5, gain 10, lose 5, gain 4, lose 2, gain 6.
But you got some support there when you went to
Got
those
some
meetings,
support,
right?
yeah.
That would be helpful, I'm sure. Diet's a big part of your life, ever?
Oh my goodness, yes. I had bariatric surgery in 2006. Prior to that, I had lost over 100 pounds twice to regain all of it and then some. Subsequent to having surgery in January 2006, I've now lost 160 pounds. So I'm very pleased with that outcome, but the idea of controlling food intake via various methods has definitely been constant throughout my entire adult life. Ultimately, it's come down to relative abstinence from starches and sugars,
right,
as being core to what I view as my success.
So you've had to make real life-altering commitments to yourself in all of this.
Absolutely,
Yeah.
totally permanent changes, and the mental focus of realizing that they are absolutely permanent is critical to not regaining weight.
Right. Mm-hmm. I mean, losing 100 pounds and then gaining it back, I mean, that had to be
Devastating.
the most just unnerving and just internally distressing experience you could ever imagine.
Absolutely, like a nightmare that you can't wake up from, and the feeling of being, I used to describe it as being at the top of a roller coaster, and you begin racing down, and the pace with which I could regain weight was just unbelievable. You were describing with this other patient, you could have a 100-pound weight swing in a matter of months, and I would say certainly within a year,
Right.
Multiple times in my life. Mm-hmm.
Did you have any medical issues that came up through the course of your obesity?
Many, yes. In fact, I associate the highest weight that I was ever at was 334 pounds, and one of the pivotal moments for me was living in my 2-story home and realizing that I was spending more nights downstairs than up because of my knee pain was so severe that going up and down the stairs was creating anxiety, and so I was finding ways to rationalize sleeping downstairs. I had a variety. I had severe clinical depression, severe obstructive sleep apnea. I was pre-diabetic, infertile. There's a long laundry list of problems, and the overall degree of immobility physically was a crushing thing that it's pretty hard to frame the way you think about it as you go about your life.
So you've had to live through some pretty drastic medical issues. How about you? You've had some medical issues yourself.
Well, before the surgery, I'm type 2 diabetic. I was on insulin. I was off all the insulin after the surgery. High blood pressure, cholesterol, sleep apnea. But my bonus for having this surgery is I found stage 1 breast cancer. I had my lap band surgery in December of 2008 and found a lump in January of 2009 and was diagnosed in February of 2009. Had I not lost the weight, wouldn't have detected breast cancer early. For me, this is a big bonus.
Yeah, I would say, do you have a family history for breast cancer?
No.
No. So and as we talked about the estrogen levels that we see with the extra weight, that can certainly put you at higher risk.
Exactly.
Do we see a much higher risk for cancers with obesity?
Absolutely. It's been amazing. I have, in the over 2,000 cases that we've done, we have about 26 cancers that we've discovered in our patients, either working up to their surgery or shortly after their surgery. Breast cancer, colon cancer. We've seen patients with kidney cancer. That's 10 times the rate in the general population. Wow. It's just been a tremendous thing for us to be, as with Marie, we've seen patients that have had their lives saved just because they thought about having the surgery and came in and found cancer in a very early stage.
So it's not just what you do for your body and how you've really rescued some of the metabolic systems that get really out of whack. And I know that being close to 500 pounds, there had to be some dramatic medical issues that were going on for you.
Oh, no. Well, it wasn't a medical issue. I just couldn't walk.
You just couldn't walk.
I could go 20 feet. It was a chore to go to the mailbox to get the mail. I would have to think about it and plan it, and it hurt. It hurt to sit. So now I can do.
Every part of your body just hurt from carrying that weight.
It just hurt to sit. I couldn't go up the stairs. I would have people get things for me. I didn't know where the mailroom was in the office for a year and a half until I lost weight. Couldn't make it down over there.
And how about your breathing? Was that affected as well?
When I went to the doctors, they would always know I was coming in because they could hear me from the other room because I was breathing so bad. But now I just exercise and it's doing great. Got my life back.
And that was the hardest part, I'm sure. I mean, even if you wanted to exercise when you weighed that much, it was...
It was a chore. I had to start by going in the pool and just walking in the pool.
Yeah, something to help you float, give you some support, yeah.
When I first went in the pool, it was just like a miracle I could walk without pain.
Wow. You had type 2 diabetes?
I had diabetes, sleep apnea. I was on 3 blood pressure medicines and it wouldn't keep my blood pressure down. I was a wreck. I was a heart attack waiting to happen.
Heart attack waiting to happen. How much did you weigh at your peak?
339.
339?
Yeah.
And you guys are related?
Yep.
Yep. We're
Yeah.
part of the same team. We all
Part of
got
the same
lap band.
team. We've got a lap band team here. huh? So a trio. But I would imagine that, boy, making that kind of decision, it's nice to have some help.
It
Did
was
you have
great.
some significant health issues?
Yes, I had a foot injury, like you were saying, Dr. Greene, that led me to, like, again, be a couch potato.
Right.
2 years.
Right.
And so during that time, you know, you get depressed, you get upset because you're not moving, and I put on a significant amount of weight, you know, during that time period. And then, I mean, looking back now at the pictures, you don't even know where you're at that stage. And then I think when you look back now, you're like, you just see how unhappy you were. You know, I think that we all felt that. You know.
Did you have a hard time? Well, you had a hard time getting out in public, so I can't even ask you if you had a hard time dealing with being in public.
It's just I couldn't move, couldn't get out,
Yeah.
couldn't go shopping.
But I mean, I think that probably everybody sort of feels they see someone who's overweight. Why don't you take care of it yourself? Why don't you go on a diet? And I'm sure people try to give a lot of advice that's
they do. Yes, they
that's
do.
really hard to take at times.
Right, and I think part of what I've learned, and I know Phil's been instrumental in this for me, is the social aspect of eating. Like, everywhere we go in our family, there's always a huge spread, and they are always saying, "Oh, why aren't you eating?" And so, like, when we first started, I know John and I especially, they would say, "I can't believe they're not eating." Oh my gosh, you know, like, and they would try to give us food, constantly push food at us. You know, our families, and then eventually they realized that we had the willpower, and we, you know, with our lap band, we were not going to do that anymore, and it has been a slow change. So the family aspect, it's good that we're all doing it together because we can kind of be the support for each other.
Was food really the core of your social relationships?
For the family?
Yes.
Yes.
I mean, it was.
We have a huge family.
Well, now
so-
it's the opposite extreme of how it
Well,
is.
you have to
now
learn
it's
that
controlling
you're
it.
just sitting there talking to people. You don't need to eat.
Right.
You don't have to eat the whole time you're with them.
Right. So was that growing up? You guys basically always had a lot of food in the house, and you think about food from literally the time you finished eating to the next time you started.
Yeah.
And our mother is a gourmet cook. And
Right.
so just a wonderful cook. And so, like, if you didn't eat, she became offended. So I know that. And, like, my sister is also a wonderful cook, you know. And so, like, when you go to her house, you want to eat their food. You want to like appreciate them. But we've learned now that, you know, again, portion size and with all the help that we've gotten, the support we've gotten, we really have changed our way that we think about food.
Right. So it's interesting, and Phil, you're the PA that she's referring to, and you've had the opportunity to work with people in understanding how they eat, and I'm sure you do a lot of history taking, and you interact with these patients in terms of how they're doing on a continuing basis.
Very much so.
And do you find that social issue seems to be pervasive?
There are a tremendous amount of issues, and they vary. They're almost as unique as fingerprints. How many different issues that each individual person brings to how they have gotten to be overweight, and the different ways that they need to alter the way they live in order to make the changes necessary to lose the weight.
Right. So they need support systems.
Absolutely.
We're going to hear a little bit in a few minutes about that. But as we've heard all these medical conditions and the size that these people have grown to, what are some of the, I guess, the indications for people to think it's time for me to come talk to Dr. Greene? What are some of the, I know it sounds funny, but it's true. What are some of the medical and physical parameters that we need to be talking about?
Well, people suffer from these multitude of medical conditions, and they watch their quality of life decrease. The end result is that they feel that the only way they can lose weight is with some assistance, and the standard now is about 70 pounds overweight. They should consider having some assistance with weight loss surgery. It is considered indicated by the FDA at this BMI of 35, and last December the FDA is entertaining the idea that they're going to allow people to have these surgeries at a BMI of 30, because we're able to show that the diabetes markedly improves with a patient that has a lap band and has a BMI of 30. Their diabetes goes away 75% of the time within 2 years. So that's dramatic. The pediatric population, or we should call it more the adolescent population, because this operation is only indicated, not officially indicated by the FDA, but amongst the physicians that do adolescent bariatric surgery, when a child has reached their physical maturity, say 15 or 16 years old, if they've struggled with weight and they have met these criteria of being 60, 70 pounds overweight, they should think about having weight loss surgery before the medical conditions become just so dramatic that they affect their life.
And you find that it's really rare for people to lose more than 10% of their weight, which is dramatic, but still, when you're 70, 80, 90 pounds overweight, losing 10 or 15 pounds just doesn't cut it. And the effort is so tremendous, I guess at that point, it's diminishing returns.
Right, because there have been multiple studies, over 100 studies over the last 30 years that have shown that diet and exercise works for only a very small percentage of people. They lose up to 10% of their weight. The results are about 1 in 100 people can lose over 50 pounds. That's a very small percentage. Right. You have to burn 3,800 calories to lose a pound. If you want to lose 100 pounds, that's 380,000 calories. 200 pounds, that's, that's over 720,000 calories. I mean, that's an enormous...
That's a lot of laps around.
That's a lot of laps.
Yeah, that's for sure. My God. It is rather incredible. Let's say your whole perspective on doing the surgery had to do with your just frustration with your weight, but had to do with some health issues as well.
Well, I had back issues. I have a bad back. And
it got a lot worse by being overweight.
I'm sure. Being as much overweight as I was made it a lot worse.
Yeah.
I also had a mild case of sleep apnea, which went undiagnosed until after I had seen Dr. Greene. But I was otherwise relatively healthy. I mean, I didn't have diabetes. I didn't have a lot of these other conditions. I mean, I was lucky in that aspect. But I reached a point where I knew it was time, and there really didn't seem to be any other alternative for me.
So you tried all of the typical ways that you do, and it was becoming impossible. How did you find out about weight loss surgery, bariatric surgery?
I heard a lot of stories on the television about that, and I went and talked to my doctor, and he referred me to Dr. Greene. Mm-hmm. And I went on the internet and found when he had his meetings, mm-hmm. and I went to see him.
And it was pretty convincing right then and there. So you decided at that time it was time to do it, mm-hmm. And you were ready and willing. And then what happened? I mean, how did you sort of rearrange your life? I mean, you had to be thinking, this is a big commitment. Mm-hmm. I'm literally going to do surgery now.
Right.
Forget the diets. Forget Jenny Craig, Weight Watchers. I'm actually going to make a commitment. So how did that come about? I mean, how does someone come to terms with that being a real necessity?
Well, for me, it was the realization that it wasn't going to get any better as much effort as I could put into it. I needed the tool that weight loss surgery gives you, and it took a while for me to be emotionally ready for that, to come to the realization that it wasn't going to be possible for me to do it any other way if I didn't have that tool.
Right. So you were going to have to give up your closest friend, food, which had been the greatest consolation, I'm sure, from time to time, and the greatest devil in your life as well.
Well, it's been a constant companion.
Yes. Okay.
I don't know if I would call it a best friend.
Yeah, sometimes those companions can turn on you, I guess. Okay. When you decided, now you were over 300 pounds?
Yeah, I was 308 pounds.
308 pounds.
My decision came, and I think everybody here feels the same way. When you start with a weight gain, you tell yourself, okay, I'm never going to get to 200 pounds. And then you pass 200 pounds. Okay, I'm never going to get to 225. And then you pass 225. And then finally I was like, I'm never going to get past 300. And I hit 308 pounds. And I was provided with this great opportunity, this wonderful gift to change my life. And I jumped on it. I didn't want to keep going and going and going and see how far I could go, how much weight I could gain. 300, that was it for me.
Okay. So, and is that the case? Most people just decide, that's it, I've got to do it. I mean, you must have some internal cue when you meet them that tells you it's time.
I think a lot of people believe that it's the quality of life that they've lost that sends them to think about weight loss surgery. I've had many mothers tell me that they were told by their children not to pick them up at school because the other kids were making fun of them, or they were embarrassed of the way their parents looked. I've had people tell me that they could no longer walk down the hall, and that's what was the kicker for them that sent them in. Other people were embarrassed. They got on an airplane and they couldn't get the seatbelt closed and had to ask for the seatbelt extender, or people that have gotten stuck in their cars. It's the last bastion of discrimination in our society. Even the federal government doesn't consider obesity as a disability. Now, if your back goes out, it's a disability, but obesity, it's not.
Well, you'd think with the fact that we spend close to $300 billion a year on obesity and its related medical and productivity issues, those direct and indirect expenses, $300 billion, that would buy a lot of our economy, if you know what I mean. And the fact that they don't acknowledge it. Do you feel you were discriminated against when you were overweight in one way or another? I mean, obviously you were self-conscious, but do you feel that it really did hinder your ability to accomplish what you were capable of doing?
I don't know if I really felt discriminated too much against. I do know that there was definitely awkward situations that I was put in, such as having to ask for an extender on an airplane for a seatbelt. That was horrific to me. Going to an amusement park and not being able to ride the roller coasters because I couldn't fasten the seatbelt. It was a terrible experience, and it was a real rock bottom point of my life.
Well, that could keep you locked in your house after a while, couldn't
Yeah,
it?
you don't want to go out because you don't want to be embarrassed anymore.
So, Dr. Tamargo, you are a clinical psychologist.
Right.
And you work with Dr. Greene.
Yes.
And you help to screen these patients to get them, to make sure that they are ready and willing, and help them understand some of what they're about to encounter.
Exactly.
So, in your perspective, what are the key issues that really do convince you that they're good candidates for surgery?
Well, first of all, we definitely assess their reason for surgery, and all the reasons that have been mentioned so far have always been there. Almost everyone says the first thing is that they don't want to die.
Right.
And they always mention all of these other issues, but they're afraid of dying, and they have a lot to live for. They want to live for their children or their grandchildren. That one is I hear that every day. I want to be able to take my child to the park. I want to be able to play with them on the playground. I want to see my child graduate from high school. I want to walk my daughter down the aisle at her wedding. So those things are all really important. Then I want to make sure that they understand the lifestyle change that's required. A lot of people misunderstand that bariatric surgery is an easy way out to solve this problem. It's not. The surgery itself is just a very small part of what is going to be required of these people. They have to make tremendously significant lifestyle changes and work for the rest of their lives to battle obesity. They're not going to become no longer obese. It's a genetic disease. It's still in their body. They're going to have to battle it for the rest of their lives. And I have to, just like Heather said earlier, they have to understand that this is a permanent lifestyle change, and they have a tool to help them battle the disease. So I'm really looking for their understanding of the surgery and the lifestyle changes and the long-term commitment, and understanding that it's not a quick weight loss, that it's going to be slow and steady. We want our patients to lose 1.5 pounds to 2 pounds a week, and do it in a really healthy way. We want to make sure that they're going to do well in the long run, that they have to change lots of behaviors. You were talking to some folks earlier about the family environment. Relationships change. Just like with an alcoholic, you're not going to go to the local bar anymore. So our patients aren't going to the smorgasbord anymore, and they have to realize that there are going to be major lifestyle changes that they're going to have to commit themselves to.
Right.
They're going to be holidays. They're going to continue to be faced with Thanksgiving and Christmas and Easter, these major meals, and they're not going to eat like they used to. And people are going to be commenting on it. You don't like my food? People are offended. And we talk about all of those things in the evaluation process, as well as their commitment to exercise and follow-up care. These patients will have a relationship with us the rest of their lives.
So you started with a family situation where you had lots of support to eat.
Right.
And now, thank God, you have a family situation where you have lots of support to not eat. We hope you guys stick to it that way for sure. In preparation for surgery, I mean, they probably had to do some pretty significant testing. I mean, you were a disaster waiting to happen.
Oh, I was. When I first came in December, Pam and I went together. I weighed 482. That was my epiphany right there. It's almost 500 pounds. I was in shock.
Right.
We had to, for the insurance purposes, we had to go and do a weight loss plan. And I went to see nutritional counseling over at their office, and I did that for 6 months, and I lost about 40 or 50 pounds during those 6 months. But once again, I was doing real good, and in the last 6 months, I didn't lose anything.
Right.
But then we started under the liquid protein for 2 weeks before. You have to do liquids.
Right.
And I did like my own little Biggest Loser challenge. For 1 week, I went to the Y every day and worked out real hard and did liquid proteins. I lost 20 pounds in 1 week.
Wow. And I bet you couldn't have kept that up the way that the banding surgery worked for you. So in preparation, you will screen them for medical and psychological issues.
Right, and we also do a very extensive educational program, and then we follow them lifelong. The educational program is about 8 hours before surgery. Mm-hmm. The patients they even have to take a written test before surgery, just to make sure that they understand all of the issues involved in it. But I think more important than the preparation is the lifelong commitment and the support that they undergo through the program. We have weekly support groups that they can attend. Some are staffed, most are staffed by psychologists or a nutritionist, and we focus on exercise and exercise training for their life.
So you all were pretty well prepped as to what was coming, and certainly we know that there are a couple of types of surgery that people hear about, what they call the restrictive and then the malabsorptive type surgeries. If you could just give us a quick overview about what the differences are. I mean, it used to be mostly the gastric bypass that we used to hear about.
Right, the gastric bypass was around for 30 years now. And before the gastric bypass, or right around the same time, there was a restrictive operation called the stomach stapling, where a surgeon would go in and just partially staple the stomach, and that just stopped or decreased a person's ability to eat. The gastric bypass, combined with combined a decrease in a person's ability to eat with some malabsorption. Malabsorption means that some of the food you eat doesn't get absorbed and it passes all the way through and comes out in the bottom. So we have the gastric bypass, which is really a tried and true operation, but the lap band was shown in the early 2000s in a comparative study to have the same effectiveness at about 5 years. So while the gastric bypass patients lose weight dramatically and rapidly, the lap band patients would lose weight more slowly over that 5-year period, and at the end of about 5 years, they've all lost about a quarter of their starting weight. And they maintain that for a long period of time.
How do you decide who gets which surgery?
Well, we really leave it up to the patient. Our practices are mostly restrictive operations, mostly lap band, but also another operation which is called the sleeve gastrectomy, which means we just take off the majority of the stomach and turn the stomach into a tubular stomach instead of a bag. By making it a tubular stomach, a person feels full faster, stays full longer, and it also decreases one of those hormone called ghrelin, which causes hunger. So the patients wake up from the operation with markedly decreased hunger. The band also works as we tighten it to decrease a person's hunger.
Wow. So you knew what surgery you were going to get, did you? Did you have to choose, or did you really know up front what you were going to do?
Funny you should ask. I'm an unusual patient in that regard because I had a gastric band, and I lost over 90 pounds with my gastric band, and then I had an unusual and acute complication that required its removal. And one of the benefits of a gastric band is in the event of such an emergency, it can be removed without any dire risk or consequence. I went about a year trying to decide at that point, while also attempting to lose weight, whether I wanted to have another gastric band or to try this new procedure, the gastric sleeve or the sleeve gastrectomy that Dr. Greene was just referencing. I decided, which was a very tough call because they're both fantastic operations, on a gastric sleeve or a sleeve gastrectomy just over a year ago, and I'm now down 106 of the 160 that I've lost total in that last year.
So that's been very successful for you.
It is. It's interesting. The experience of living with a gastric band and the experience of living with a gastric sleeve are markedly different, although they both are very effective in different ways.
So you've got to enjoy 2 flavors. Yes.
Yeah.
Interesting. So being prepared for surgery, you've had to do that twice.
I have.
Was it scary?
Yes, definitely. There's, I think, as with all surgery, there is a risk of death, and one of the things that all patients have to come to terms with is balancing the risks of surgery with the risks of remaining obese, and the likelihood that they would be able to overcome their obesity absent the surgery. And like all people, I struggled with that decision and the constant battle of, could I do this without a surgical intervention? Is it really possible? Can I get myself to believe in it one more time? That type of thing. So yes, it is scary. It's definitely a peak stress period as you're preparing for the surgery and coming through that process, which is one period of time where behavioral health and psychologic support is so valuable.
So you made it through, and you did it twice. And
I did.
Yes, you're aware. You've got notches on both sides.
I do.
And I guess the surgery itself. How quickly did you recover?
Well, with the gastric band, the recovery is typically about 1 week. And with the gastric sleeve, it can be between 1 and 2 weeks, depending on how a patient responds to the procedure. I felt pretty much back up to speed in 2 weeks.
Mm-hmm. Well, and I mean, all patients have certain risks for complications in a surgical procedure. Infection, I guess an embolic phenomenon, something where they get a stroke or something really odd happens. It's not very common, relatively speaking, but it would be more common in this patient population.
Yes, our patients come to us and they have many unrecognized conditions. And so our society, the American Society for Metabolic and Bariatric Surgery, set up a system about 10 years ago to help the physicians that do weight loss surgery, and set up a system called the Centers of Excellence. And amongst the Centers of Excellence programs, the chance of dying from one of these operations is about 2 in 1,000 to 3 in 1,000. So we've gone from about 1 in 100 over 10 years ago to 2 to 3 in 1,000 over this last 10 years. So it's become much safer, and we have a lot of protocols to help us to try and combat the potential complications. And it's made it a very safe operation for the American public.
Right. And so what I've understood here is that you have a certain setup biologically that would put you in the risk factor for not ever being able to lose that weight. You've gained enough so that you're at that point. You do some screening, both psychological and then some physical screens. I'm sure that you have to look at pulmonary function, heart function, and all those kinds of things to make sure you're a reasonable operative candidate. And then you do some screening in your office for psychological purposes. And then, from what I understand here, you put them on a diet, both, I guess, to rev up their metabolic change process as well as to demonstrate their commitment.
Mm-hmm. It works in both ways. It does. And if anyone could stay on a very low-carb diet for a prolonged period of time, they would lose their weight, and they would lose their diabetes and their medical conditions. These operations only allow the patient to maintain that commitment to feel good about a small amount of protein food and not feel very hungry following 4 to 6 ounces of food. So it's really just a tool that any patient can use to help them stay on the diet.
And from what I understand, listening to everyone, most of what you do is laparoscopic, or using a scope and a minimally invasive method.
Yes, almost all of our surgeries are laparoscopic. Even our revisional surgeries are laparoscopic, which means we put a series of small tubes about the size of one of those old Bic pens into the belly. We fill the belly up with carbon dioxide, put a high-definition television camera in, and then we can operate through those little ports almost by remote control. It's really neat. It's a lot of fun.
And you can, yeah, I bet. None of you were awake for the procedure, I would take it. You didn't see him laughing and joking, but so you had a procedure. What kind?
I had the sleeve gastrectomy.
The sleeve gastrectomy. So that, and did you feel like that was the right one to choose? I mean, you had some insights.
Yes.
Yes.
April last year, I saw Dr. Greene for the first time, and I was going in thinking I would do it a band because I didn't know about the sleeve. And in the visit, he explained all 3 surgeries: the band, the sleeve, and the bypass.
Right.
And we decided that the sleeve, if insurance covered it, would be the best one.
For a real long-term.
For long-term, because that day I was 412 pounds.
Right. Wow.
And
so 412 pounds was really a dramatic.
Yes.
Place
in
to
December of the year before, my doctor had placed me on 3 blood pressure medicines and an asthma controller because I was having a constant asthma attack.
Right.
And that scared me to death. And once it was controlled, I went, okay, so we got to do something. Let's go see Dr. Greene.
So your surgery was when?
August.
In
last
August.
year.
Okay. So you're just barely 6 months out.
6 months out yesterday.
And you've lost so far?
135 pounds.
135 pounds. That's dramatic. It is. And you're on the train. You're not getting off for a while.
No.
When was your surgery?
My surgery was in September this past fall.
Okay, so that's even more recent, right? And how much weight have you lost since then?
Since the surgery, I've lost over 70 pounds. I started on the diet back in July, and I've lost 108 since then.
Wow. That's fantastic. And when you go through this, I mean, you really do have to adjust your eating, but has it been hard to do?
Initially, yes, because the first thing you know, no bread, pasta, potatoes, rice, cereal, or fruit.
Oh my God, how are you going to eat? What are you going to do? Yes.
What's still left? Yeah,
you have to give up your nationality if you're Italian. What are you going to do, right?
And I had 2 friends on the train who had surgery up in Frederick, and they said, oh, don't go with Dr. Greene. He's got a really strict food plan. You can't eat this. You can't eat this. You can't eat this. And I said, Well, I've been eating this stuff on Weight Watchers and never losing it. So, the minute I started it, I started losing weight.
Boy, it sounds like kids out in the playground, trying to get you to do things you shouldn't want to do. But boy, that is dramatic. And the most dramatic, from what I've been able to observe, has been you. And you had a little inspiration to really get that last little phase off.
Right. I got the lap band surgery May of 2008. Right. And in November of 2008, I got engaged. I knew I wanted to have an October wedding, but I knew I wasn't going to be at my goal weight in October 2009, so I actually prolonged my engagement just so I could get down to my goal weight so I could look fabulous in my wedding dress.
Well, and I know that we have pictures of that, and you absolutely do. So you guys have gone through incredible work and really done an incredible thing to bring this together. Do you do much of the invasive surgery in terms of more the the bypass type procedures anymore?
Well, we do some of the bypass procedures. Medicare does not approve the sleeve gastrectomy, and some patients don't want to have the lap band, and so for those patients, there are a few patients that we still do the gastric bypass on, but most of the patients are having the band or the sleeve.
Right. And in the outcome, the kind of success over long term, can you give us sort of an overview?
About 80% of the patients lose 2/3 of their extra weight, which you can calculate the difference between the weight they start at and the weight that they should be at, and we call that the extra weight. So say a 250-pound person would level off at about 190 pounds 80% of the time.
And they still can be motivated and lose more if they so desire.
Absolutely. Right? As you've seen here, many patients do lose more.
Yeah. Well, it is a remarkable, journey, as you could say, and I'm impressed by all of you. I'm really impressed by the whole organization and the way the support works, and I know that you have continuing support with each other and through the offices there. Anyway, I hope that you've been able to get a pretty good sense of, well, what obesity is really all about and what you might actually think about doing if you've really suffered through all the diets. Know that Dr. Greene is here. We have other surgeons here in Fairfax as well, and certainly he can help refer you if it's not convenient to go see him out there. But either which way, I want you to know you have support here, and we'll be here for you. Until the next time, I'm Dr. Russell Libby, and I'll be looking out for your health.